Psychedelics, they're hallucinogens that alter a person's perception of reality. And now, they're also a form of medicine.
Because you're in this altered state, you can look at that bit of yourself that always felt dark, unbearable, unwanted, and you can have conversations with figures that have been really troubling for you.
Just last year, Australia became the first country in the world to legalise the use of psychedelics to treat mental health.
These are very much pharmacologically manufactured substances. They're not the sort of MDMA that people might be aware of on the street.
The move allowed approved psychiatrists to prescribe MDMA to those suffering with PTSD and magic mushrooms for some types of depression. It's an approach some patients and practitioners say has worked wonders.
We saw in 6 hours what you would often see in 6 years of therapy.
On the lighter side of the psychedelic was this joy and wonderment and curiosity and all the things that I love about myself.
But some experts worry the drugs can cause bad trips, leading to patients re-experiencing trauma, while others say the treatment option has been approved way too fast.
We made 2 submissions to the TGA where we really said this is too early. There wasn't enough data at this point, but nevertheless the decision has been taken.
Now a new documentary is following Aussie patients in a world-first 2-year trial using psychedelic therapy for anxiety.
I'm scared of everything.
I've had issues with anxiety ever since I can remember.
Panic attacks.
72 participants with generalised anxiety disorder undergoing a 10-week treatment plan involving psilocybin, the key ingredient in magic mushrooms, alongside multiple therapy sessions.
How do you stop the pain? There's enormous potential, but not without risks.
So let's find out how it went.
Dr. Paul Liknaitzky heads up the country's first clinical psychedelic lab and led the groundbreaking research. Dr. Paul, does this actually work?
Yeah, well, what we're discovering in our lab at Monash University and indeed across many groups around the world is that there is enormous potential for psychedelic-assisted therapy in treating mental illness. We've seen up close some remarkable transformation in people's lives. People will report having a remarkably different perspective on their lives or their problems, and it is that very different perspective on their lives or their issues that allows them to make changes and gives them hope.
But Doctor, you sound like you're just describing people on a drug high. Do you know what I mean? Like, is there a downside to it, like where they have a fall or they have Tuesday blues day or they want to go back to the source?
So, yeah, good question. Actually, for the vast majority of patients who we treat, this is not thought of as a high. These experiences are often reported as one of the most personally profound, meaningful experiences of someone's life, but they're almost always incredibly challenging. This is not about euphoria and blissing out. Although you can experience all kinds of emotions, it's often about coming face to face with the sources of your distress in your life. No one should make analogy to, self-medicating in the wild or recreational use, whatever the value may be in that.
You mentioned this is a complex story. Experts do seem to be a bit divided on exactly how fast we should be going down this road. Do you understand those experts who are a little bit reluctant here?
Yeah, look, I have a lot of sympathy for a whole diverse set of perspectives on this. I work in a very strange place. My job is right at the interface between stigma and hype. And there are grave problems with the prejudices on both ends of the spectrum, and we need to deal with both of those. But I suspect also a lot of people are nervous, a lot of professionals are nervous, in part because they don't understand how to do this work, and they don't understand what it takes to do this work. And I would be nervous too if I didn't have that hands-on experience. And this is about going to fundamental causes of the problems in your life and trying to provide people with a new lease on life. And that's a tough gig when you're up against the realities of mental health. And so that's my focus now.
Dr. Paul, well, I've actually got a bunch of friends that are working in a very similar field to you. They're not publishing their results, however. But I do have a question, right? So would it not be obvious to a patient that whether they're on the psilocybin or the placebo, they would know, wouldn't they?
Yeah, it's a good question. So we do placebo-controlled trials, and yet you're right. If you've taken a high dose of psilocybin, there's no points for guessing that you've had the active. We do sometimes get people who are confused about what drug they're on, particularly when they've had our placebo. Our placebos that we use are called active placebos, so we give another kind of drug that has psychoactive effects as well. But bearing in mind, when you do a placebo-controlled trial, you're not only trying to disguise what drug the person has consumed, you're also attempting to provide your control group with all the same treatment program that you've provided to your active arm. So they get the same amount of psychotherapy and all the assessments and all the attention and so on. And so we're looking at what the difference is when we add psilocybin into that.
Okay, Dr. Paul, we appreciate your time. Thank you.
Thank you.